In other news, immigration is a hot topic, specifically how immigration policy and COVID-19 have intersected along the U.S.-Mexico border. It's called Title 42, and the Biden administration wants to change that. It's a section of federal law that the Centers for Disease Control used in 2020 to essentially close our southern border to asylum seekers. Supporters of the Trump-era policy say it's needed for safety, yet will stay in place for now. Newsy's Lauren Margrino dives into the debate.
When the pandemic began in March 2020, some officials urged international unity.
COVID-19 can be characterized as a pandemic. We're in this together to do the right things with calm and protect the citizens of the world.
But many nations, including the United States, responded to the crisis by closing their borders.
To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days.
Then the administration announced an even more restrictive policy, closing the border to asylum seekers. The Centers for Disease Control cited Title 42 to prohibit entry of anyone crossing the U.S. border for asylum or without permission. Under the Trump administration, 83% of migrant encounters at the border led to immediate expulsions. When President Biden took over last year, he maintained the policy at first, but last month, the administration announced it would be ending it on May 23rd. Homeland Security Secretary Alejandro Mayorkas spoke about the move last month in an interview with CNN.
Title 42, as it is known, is a public health authority. It is not an immigration policy.
Barring asylum over the last 2 years has coincided with unprecedented crime and violence in a number of nearby countries. So human rights groups have attacked the Title 42 policy as heartless.
This year I've interviewed hundreds and hundreds of families. All of them have been kidnapped, raped, attacked at gunpoint at least once, if not 2 or 3 times.
Meanwhile, some medical groups support ending the policy. 4 doctors writing in the New England Journal of Medicine criticized the law as ineffective and cruel. They point out that travel across the Mexico-U.S. border has been allowed for most of the pandemic, unless you're an asylum seeker.
These exclusionary practices are not now and were not ever based on sound public health.
The government expects the end of the Title 42 policy to create a new surge in asylum seekers. The Department of Homeland Security is adding staff and buildings to handle the increase.
There will be an influx of people to the border. And so we are doing a lot of work to plan for that contingency.
After Biden announced his plan to end the Title 42 policy, Texas Governor Greg Abbott began providing willing asylum seekers bus rides to Washington, D.C. The Biden White House slammed the Texas governor's move as a publicity stunt.
We are sending them to the United States Capitol, where the Biden administration will be able to more immediately address the needs of the people that they are allowing to come across our border.
Ahead of the May 23rd change for asylum seekers, officials report a surge in border crossings. Border authorities arrested 210,000 migrants attempting to cross from Mexico in March, a 24% increase over the same month last year. The next chapter in this fight is unfolding in the courts. The judge that halted the Biden move to end Title 42 was responding to a suit filed by 21 states. The states and the administration now will prepare legal arguments before the restraining order expires on May 9th. Lauren Margrino, Newsy.